Thank you, Mr. Chairwoman. I appreciate it, and thank you for holding this hearing. Ms. Stewart, with the United States ranked 25th in the number of stillbirths per capita, why do you think these rates remain unchanged despite medical innovations? And what interventions do you think other countries have done that we aren't, that's lower their stillbirth rates?
Thank you, Congressman. I think it's a very good question. I mean, yes, we've seen stillborn rates where today 24,000 babies die as a result of stillbirth, and that rate that number has not really improved. In fact, when you look at other countries, we are ranked 183rd out of 195 countries in terms of reduction of stillbirth rates over the last 2 decades. So we have a lot of work to do. When you look at other countries, they have implemented successfully, for example, in Australia, some impressive care bundles that look at issues around early detection of fetal growth restrictions, smoking cessation, which we actually do focus on a lot in this country, decreased fetal movement, safe sleeping practices for moms, side sleeping practices, making sure that babies are avoiding early C-sections so that they are not born early. You know, one of the things that we have to do is just have a more comprehensive approach to maternal care. And I think a lot of the gaps in our system of care, again, these maternal care deserts that I talked about, the lack of access to care if you don't have insurance or if you just don't even live near a care provider, are all contributing to the high rates of stillbirth. And because we have not made comprehensive improvements in maternal care in this country is also why we have not seen much improvement in stillbirth, even though we've seen increases in NICU care, where we've seen technology and medical care actually extend life of babies in the NICU. We have not seen that same kind of advancement with stillbirth.
Thank you. How important is adequate data then to fight against stillbirths?
Sorry, I just want to make sure how important is adequate.
Yeah, when you start looking at data, what do you feel about? I mean, there doesn't seem to be that good of information out there when we start talking about data, and so when we're looking at fighting the stillbirth, I'd almost say a pandemic, but it's not really. But you know, the serious issues we're dealing with there. When we're looking at it, how important is that data?
So it's really important. One of the things that we know when a stillbirth occurs is that it may be noted on the death certificate, but that doesn't explain the full reason or all of the underlying issues that may have led to the stillbirth. And in fact, some tests that would determine that actually are made available sometimes weeks after the death certificate is actually filed. And so we haven't been actually collecting all of the best data around stillbirth. And so what the Shine for Autumn Act will hopefully do is to provide more resources so that we can do a much better job of research and data collection to understand first the underlying causes of stillbirth, which we need to do more of that around preterm birth and miscarriage and all of that as well, but also better data collection around stillbirth so we can design better interventions. We saw this same kind of progress that we made with maternal mortality when Congress passed legislation that would allow for maternal mortality review committees. Collecting better data allowed us to identify better underlying causes of maternal death, leading to better interventions. The same needs to be true for stillbirth as well, and that's what we hope the Shine for Autumn Act will do.
Well, thank you. Thank you so much because you answered all my other questions while you were answering that question. I really appreciate it. In closing, I just want to second what Mr. Butterfield said earlier. He made a suggestion that we look at the Better Wound Care Act at home and maybe look at doing an upcoming hearing on this. Madam Chair, I would like to say I'd like to second that because it's an important policy that's good for our patients, and hopefully I look forward to advancing this through the committee. With that, I yield back.